Have you ever found yourself in a situation where you're unable to maintain an erection even when you're in the mood for intimacy? This is a situation that many men find themselves in at some point in their lives. It's called temporary erectile dysfunction, and it's more common than you might think. Temporary erectile dysfunction, or ED, is not a long-term condition, but rather a temporary issue that can be triggered by a variety of factors. It's not a formal medical diagnosis, but instead describes a period of time where a man may struggle to achieve or maintain an erection. Researchers suggest that a diagnosis of erectile dysfunction should only be considered if symptoms persist for 6 months or more. With temporary ED, symptoms usually improve within this time frame. Most often, temporary ED can be linked to a specific situation, medication, or medical condition. Once these factors are addressed or resolved, normal sexual function typically resumes. However, it's important to note that if you are experiencing issues with maintaining an erection more frequently than usual, it's crucial to consult with a healthcare provider. They can help identify the cause, provide treatment for any underlying conditions, and prescribe medications such as Viagra or Cialis to help regain function if necessary. The symptoms of temporary ED are the same as long-term erectile dysfunction. These include the inability to get an erection when desired or losing an erection too quickly for satisfying sex. The specifics of these symptoms can vary between individuals, and what might be considered a problem for one person might not be for another. It's a highly individual and subjective experience that should be discussed openly and honestly with your partner and your healthcare provider. There are many potential causes of ED, including medical conditions such as heart disease, type 2 diabetes, high blood pressure, Peyronie's disease, obesity, neurological diseases, low testosterone, and psychological disorders like depression or anxiety. In summary, temporary erectile dysfunction is a common issue that many men experience at some point in their lives. It's often linked to specific situations, medications, or medical conditions, and symptoms typically improve within 6 months. If you're experiencing symptoms of ED, it's important to consult with a healthcare provider. With the right treatment, you can regain normal sexual function and enjoy a satisfying sex life once again.